Hi, this is Dr. Christy Del Castillo Hagee from Fed is Best, and we're here with Dr. Heather McLeod from North Vancouver, Canada, and we're here to talk about her experience as a physician of more than 30 years. And so we have a very rare opportunity here to speak with a physician who follows babies from birth to adulthood to understand the full spectrum of what these feeding complications result in long term. Dr. McLeod, thank you so much for joining me.
Yeah, my pleasure.
We have known each other for a
Yeah.
while. Dr. McLeod is a big Fed is Best supporter because of what she's seen as a physician. So, Dr. McLeod, tell me about your background, first of all.
I did my family medicine training, and that included a 2-year residency after medicine. Went to University of Calgary, and then I moved to Vancouver, and then I've practiced obstetrics pretty well in family practice for over 30 years, and I've done large volume deliveries and following my own patients in the office, which is the model that we have for family practice. And when I graduated, and this was in the early 90s, the Baby Friendly Health Initiative had not been implemented. We had always topped up with formula in the nurseries. There were still some nurseries back then. It was a very easy time to practice because these moms had their babies when they needed to nurse them. They actually were in a nursery after that, evenings if they needed to sleep. And there wasn't the shaming that exists today. Back then, there was some starting, but you just didn't hear about it until Baby Friendly Hospitals, the initiative was brought into the hospitals, and it was a drastic before and after event when that happened. So initially, very comfortable moms that weren't exhausted, they did have the opportunity to put the babies in a nursery. To fast forward, in the late 90s, I was on various committees in the hospital, and I started hearing about the Baby Friendly initiative and what it meant for the hospital, how we were going to change things. I was open to all that. I thought, I'm not quite sure intuitively how this is going to work, because what about those moms that just don't make enough milk? What are we going to do then? Well, the lactation consultants will probably have to hire more, and they're of course trained in what they should and shouldn't do. And then about 9 years later, I can distinctly remember, as my first son was born in the year 2000, that's about the time where things were really changing. There wasn't any nursery, the babies were rooming in. I wasn't supposed to offer any formula anymore, even if the baby hadn't peed, even if the baby was obviously crying and hungry. I would scratch my head and I would bring this to meetings, and I just said, this isn't making any sense. These babies aren't doing well, but we kept going. Fast forward 20 years, it's a disaster because of the shaming.
Yeah, okay, tell me what that disaster is 20 years later.
Well, watching over 20 years, especially in circumstances where I really felt that if these parents are obviously going home, the mother doesn't have any milk, the baby's already at 8 or 9% loss, sometimes even 10. They're still going home. They have been told that they really probably don't need any formula. And then they come back into my office, 12% loss. The baby is so lethargic that it can't even lift its head up. It's not urinating more than maybe twice. It's all crystals. Crystals in the diaper are normal. Not every time they pee, they're not. The lethargy, the skin turgor, the mucous membranes, they're all dry. You know, we still don't need formula. Yes, we do. So I decided a long time ago that I can't watch this, and I don't want to stop doing obstetrics. I either have to do obstetrics and practice the way that I think is healthy while supporting breastfeeding, encouraging them, and walking this tight line in my hospital where I'm supporting breastfeeding, but I'm keeping a baby alive. So we went from these chubby, sweet babies that looked fed to these really scrawny, they're still alive, but we keep going. And I decided I can't do it. I can't. And I decided there that I don't care if I'm unpopular. I really don't care what they think. So if I have to hide formula under my arm while I walk to a patient's room, I'm going to do it. Yeah. And that's what
resistance.
I did. It is lessening over the last few years because I think they are hearing, probably through your site and through other mothers talking and social media working against them, that, you know what, this isn't all that it's cracked up to be in terms of this exclusive line, a horrible word that is intended by WHO and all of the organizations that push this beyond what it should be pushed, and the extent it should be pushed on mothers and babies that are not doing well. And these words are designed to make them feel so completely inferior, so completely shamed, even in this day and age, that they're doing things that they simply shouldn't be doing. Exclusive.
What
The
words
word exclusive needs to be put in a dumpster forever. It is intended to make people feel excluded if they aren't doing that. And some of the best moms are looking at that word, that feeling of high school coming back, of I better fit in and be part of the clique or part of this group and be exclusive. How's the baby doing? Well, I don't think it's gained more than about 10 to 15 grams a day, which, according to some health authorities, is almost okay, but they're falling off even the WHO curves. So they can't even stay on the WHO curves at less than 28 grams a day in the first 2 to 3 months of life. But if they go into the public health office, 20 grams a day is okay. They're crying all the time. No, that's fine. They're fine. No.
Before Baby Friendly, I want to ask you, what % of babies you think got readmitted or had an extended admission for phototherapy because of dehydration and jaundice? What % would you say?
Oh my God. I think maybe never for failure to thrive or dehydration from my practice back then. In terms of phototherapy, I would say readmits are less than 5%. I mean, now it's all the time. I mean, they can't even keep up in a pressured health system.
What % do you think of babies? Yeah. What % of babies do you think that you're seeing in this Baby Friendly hospital initiative area that are getting readmitted for jaundice, for not getting enough to eat?
With the combination of the 2-minute delayed cord clamping and exclusive breastfeeding or promoting no formula, I would say we're going to have one readmitted almost every time. I would say at least 10 to 15%. In the readmits in the first week, and that takes its toll on families. The poking, the hospital visits, the delay in feeding because they're always going back and forth to the lab. I get upset, but then after 20 years, you just hope that pendulum is going back to common sense, and that there's either litigation or there's a realization that these rules that the WHO have put into place have to be examine stuff that they threw out at the world 25 years ago and say, you know what, we're accountable. People listen to us, and we need to do studies on the information that we've imposed upon hundreds of thousands of hospitals and patients and little ones who are now adults.
Since you have your patients through childhood, adolescence, and into adulthood, what are you seeing from the babies who have the most serious complications of insufficient feeding, the dehydration, the jaundice levels, hypoglycemia from not getting enough milk while exclusively breastfeeding? What are you seeing?
This is where the money is, really. This is where it all comes down, is what goes on at home, how they've been informed, and how indoctrinated the patient is to the program. And how open their mind to the idea that maybe I don't make enough, because that's not even a possibility in all of the social media indoctrinations and the shame words like exclusive and the bullshit words, but like sleep regression, which is hunger. I love that. I love that one. Anything. That's called
anything but insufficient.
And it's not insufficient feeding. It's not hunger because they're getting older. Let's give it another phrase to mean we're going to okay you. I don't want to use the word starving, but you're just kind of slowly making your kid think that they just don't need that much. Highly educated women that have unfortunately had some not so great outcomes with their kids because of the all or nothing indoctrination that they've gotten. Watching these kids grow, that's the heartbreaking part of my job. But I can see it coming. I can tell even by the time they're 8 or 9 months, how they're growing, their development, who's going to be the kids I have to watch, and who are going to be the parents that are telling me at 20 months they're not talking. That's what I see. Yeah, and there is delays that the kids catch up, but as you've written, by the time you have delay, you've had loss of brain function. And yes, there's familial tendencies, and yes, we can finally get some iron rich foods, more fluid into that kid and help that brain grow. And even if it's by the time they're 6 months and they're finally allowed to eat some food, we can rescue those brains. But it's really how they grew in that first year, especially the first 6 months, where the hydration and nutrients that baby gets, that is what allows that brain to grow and make those neural connections. We can have a perfectly healthy brain at birth, lots of oxygen, lots of great prenatal care, and then it all goes sideways after that, just like a flower that hasn't been watered or fed properly. So it is an insult to the brain that causes these neurological events that unfold, and one begets the other. So if I see a kid that is poorly thriving, and I chart them all on the WHO curves, and even on their curves, the kids that are really slowly growing, or they're falling off their curves, or they're starting at 90th, and by the time they're 9 months, they're just not fed properly, and they're down to like the 10th or 15th percentile. Those kids don't do well. Or the ones that are born very small, and we just can't get them up over the 5th percentile. We can't even get them up over that. Like, it's just a matter of time. There's so much misinformation out there. So these kids end up classically having issues, and I can't say it causes autism, but these kids classically end up with learning disabilities, autism, all kinds of gross motor issues. I haven't even talked about growth. Their height is directly correlated with their weight gain. They have got nothing to gain or grow from. How can they get taller? They'll just have a growth spurt when they're a teenager. No, they won't. No, they won't. They're 16 now, 17, and they still haven't had this growth spurt. This is the hardest part. Is I almost feel like saying, should I get the developmental, put you on a list now? But I would never say that. That's right. Because these kids are going to end up there. That's what I see.
So true. I mean, I can't tell you how many people I know just in my community whose babies starved as newborns. And I try to warn them, and maybe they sort of listen, and maybe they kind of follow the people that they entrust their care to. And then years later, I'm talking to them, and they have to go in and get in line to see the developmental pediatrician that has a waiting list of 1.5 years because there's so many babies in this position now.
Yeah. And when you and when you talk to the developmental pediatrician and you pull them aside, because everybody has to be careful about what they say, and you say, what do you think is the cause of this neurodivergent explosion? Every class has 3 or 4. Nobody's noticing. Of course they notice. Right. Of course they do. Why isn't the World Health Organization concerned about that?
Right.
Why? Because it points the finger back at them.
Points the finger back at them. They're literally exposing children to brain-threatening conditions that did not exist before their policy, and now there's a fallout. And they're not taking responsibility for it.
No, they don't want any investigations done. They don't want any studies done.
Oh, of course not. This is the craziness of all this. It's like all the health organization understand what jaundice does to a newborn brain. They all know what hypernatremic dehydration and low blood sugar does to a newborn brain. There's causal relationship. They know that these complications have increased as a result of the exclusive breastfeeding policy. And yet no one's pointing a finger to this connection between a change in policy that exposes children to brain-threatening complications and a global rise in every childhood disability, seizure disorders, intellectual disabilities, cerebral palsy. Every single childhood disability is rising all across the globe. And somehow everyone's just going along because that's what we're told to do. And then when we actually confront the World Health Organization, as you've probably read in the introduction, the fact that they were confronted with this and they know that it's happening and were asked point blank, what are you going to do about it? Are you going to inform the public that they can prevent this from happening with a bottle of formula or a can of formula? Are you going to do something about that? And they pretty much said no.
No.
In their political way, they said we didn't identify it as a problem because you didn't want to identify it as a problem.
Because they've got a big problem on their hands. They've got a
huge problem.
A huge problem. And they are going to have the can of worms opened, whether they like it or not. Like it really will be one of the biggest disasters I think that they have to face, because they initiated policy with no checks or balances, no research afterwards other than promoting their cause, no research on the individuals that they've affected. About kids, when I went to bed at night and I thought, I just feel so sorry for them. I feel so sorry for them. It's
the day that I read that paper from Cincinnati that I referred to in the book, where it was just a handful of cases, but enough cases to tell you a very, very important thing about feeding babies. When they described the MRI findings of these symptomatic hypoglycemic babies who did not get enough milk at the breast. Before I saw that, I thought maybe like spots of brain injury is enough to cause these major developmental changes, of these major effects. But when I saw that it was entire lobes of the brain, a third of the brain,
how is it going to be normal?
3/4 of the brain.
I mean,
how is it possibly
how is
going
it
to
possible?
be normal?
I just finished in recertification the 16th time in NRP, and I have to make sure that kid gets enough oxygen. And then we're going to take this brain and we're going to deprive it of calories and hydration and potentially toxic bilirubin if there's not enough milk, which no one knows how to quantify. So we're going to focus on the pregnancy and the delivery, but then what you do after that and all the information we're giving you, good luck with that. Just good luck. I hope they turn out okay. Let's hire more education assistants in the school, because we're going to need them. Let's put through more developmental psychologists. Let's train more speech therapists, because we're all going to need them.
We're going to need them because there's a lot of babies. Because
we can't turn back on what we said. So we better not do that, because we'll be in trouble. But let's just keep this ball rolling, affecting the families and the individuals themselves.
That's right.
Their future.
Right. There are people who are just trying to keep their jobs and who are allowing babies to be harmed because they made a mistake.
They made a mistake.
And are unwilling to admit it to the public, even if it's going to save millions of lives from these horrible outcomes. My gosh, I can't, it's just so hard to wrap my head around. And my fantasy is that Melinda Gates, who has broken off into her own foundation, will listen. Because the Gates Foundation is the second leading donor to the World Health Organization, second to the United States government.
She needs to hear this. She needs to hear that I've got 2 boys, and one of them as neurodevelopmental challenges, not due to insufficient feeding. I'm hazarding a guess as to why. So there's not dehydration. The only other issue I could think of was bilirubin and the jaundice and the degree. So these are not small things that even a doctor can say, well, how long was his bilirubin that high? But what I'm getting at is, if this could happen to us, it can happen to anyone. And you are trying your best, but the last thing we need is to feel guilt about whether we're going to do something wrong by feeding our child. And the last thing we need is to be shamed really by their policies, and to also feel that as professionals that we're going to be treated poorly in our jobs if we offer something to help them feed their babies. Even moms that want the formula and they have to ask for it, and they're actually refused in the hospital, and
Yes.
they're refused the formula. That's a human rights violation.
That is a human rights violation.
We can be
Yes.
concerned about so many human rights things, but a mother who is vulnerable in a hospital can't ask for formula. That should be treated as negligence. And
I so agree.
yeah,
Gosh.
that's negligence. That's negligence. And that should be, that is a huge no-no.
Gosh, I love you so much, Heather. I can't even contain.
I've been thinking this for years. I've been thinking this for years. You can ask my children, you can ask my partner. I've been thinking this for years. And when I came to Fed is Best, a lactation consultant patient of mine said, Heather, I found this social media group. I think I found your people. I looked up at the stars and the heavens and I said, I found my people. These people are.
Well, it's people like us. In order to change things, you have to have people who are different. And you have to have people who are different with big voices. And the more those big voices speak up and point to just common sense and basic humanity, the more physicians, the more health organizations, the more people are affected and inspired to listen to their human instincts and their sense of compassion. Now that it is known that there is a danger to letting a baby go hungry for the sake of exclusivity.
It's not normal.
It is known.
It's not normal.
And it's not normal. It's not best. And there are people who are continue to provide misinformation to the public, including the World Health Organization. They do not have a monopoly on knowledge, and clearly they didn't do their job.
They don't want to do any back checks either. I think they should be forced to, actually.
Forced to. And because all these other organizations backed up their recommendation on the belief that they would have done their job, that they would have done the basic
everybody
work
involved is doing their job.
To ensure,
everybody is doing their job, but the whole thing goes back to every level is accountable. Okay, every single level is accountable. All of them.
Yeah,
and
that's right.
And if you do something that creates harm, and that harm is proven, as in here's the proof, and until they do those studies, and if the World Health Organization doesn't do it, somebody else does, and somebody else has to do that, because they're not going to, because they don't want.
Yeah,
they know, they just don't want to.